We live in an era of paradox. On one hand, we have advanced robotic surgery and gene editing. On the other, nearly half of the world population still lacks access to essential health services. For billions of people, the first line of defense against illness isn't a modern hospital, but a practice rooted in thousands of years of history, traditional medicine. But for too long, these two worlds, the ancient and the modern, have existed in silos. Until now, in December 2025, a historic shift occurred. The World Health Organization, in collaboration with the government of India, convened the second Global Summit on Traditional Medicine in New Delhi. This wasn't just a conference, it was a global convergence. Over 800 delegates, including health ministers from 20 nations, scientists, and indigenous leaders, gathered with a singular, bold mission to restore balance. The theme of the summit was Restoring Balance for People and Planet. It acknowledges a simple truth. Our health is inseparable from the environment and our heritage. But this summit moved beyond philosophy. It was about hard data. The goal? To integrate safe, effective, and culturally rooted traditional medicine into mainstream healthcare systems, not as an alternative, but as a foundation for universal health coverage. At the heart of this gathering was the launch of the WHO Global Traditional Medicine Strategy 2025 to 2034. This is the blueprint for the next decade. It addresses a critical gap. While 170 countries report using traditional medicine, very few have a formal strategy to regulate it. This new roadmap pushes for rigorous scientific validation. It's no longer enough to say a remedy works because it's tradition. The WHO is demanding evidence, safety standards, and quality control, ensuring that what we take is both effective and safe. The political will behind this movement was solidified in the Delhi Declaration. Endorsed by 26 member states, this declaration is a promise. Countries have committed to integrating traditional medicine into their primary healthcare systems. This means that in the near future, your local clinic might offer acupuncture or herbal therapies alongside standard antibiotics, all covered by your health insurance. It represents a shift from sick care to true health care, focusing on prevention and well-being. One of the most exciting announcements was the unveiling of the Traditional Medicine Global Library. Imagine a digital repository containing 1.6 million records, from ancient texts to modern clinical trials. This isn't just a database. It's powered by AI. The new TMGL-GPT tool allows researchers to cross-reference thousands of years of indigenous knowledge with modern medical data instantly. This is the digitalization of human healing history. The summit also launched Health and Heritage Innovations, or H2I. This initiative is an incubator for ideas that bridge the gap. We're talking about using genomics to understand why certain herbal mixtures work for some people and not others. We are talking about using artificial intelligence to discover new drug candidates hiding in plain sight within ancient pharmacopoeias. It's the ultimate collaboration between the laboratory and the forest. But there is a warning embedded in this progress. Traditional medicine relies heavily on biodiversity, plants, fungi, and natural resources. The summit emphasized that we cannot have healthy people on a sick planet. As demand for herbal medicine grows into a trillion-dollar industry, we face the risk of overharvesting. The strategy calls for sustainable farming and the protection of indigenous lands, recognizing that the guardians of this knowledge must also be the beneficiaries of it. This brings us to a crucial point: respect. For centuries, indigenous knowledge has been exploited, taken without permission or credit. The new WHO strategy explicitly focuses on the rights of indigenous peoples. It demands respectful information exchange. It's about ensuring that when a pharmaceutical company develops a drug based on traditional knowledge, the community that preserved that knowledge shares in the benefits. It's a move toward ethical science. Critics have long argued that traditional medicine lacks scientific rigor. The summit tackled this head-on. The WHO is not asking us to blindly believe in old remedies. Instead, they are establishing new research methodologies. Because traditional medicine is holistic, treating the whole person rather than just a symptom, it doesn't always fit into the standard randomized control trial box. New methods are being developed to test these complex interventions scientifically, ensuring we separate actual healing from placebo. Let's talk economics. The global wellness and traditional medicine sector is booming. It's already a multi-trillion-dollar industry. But there is a disparity. While wealthy nations consume expensive superfoods, billions in developing nations rely on these medicines for survival. The WHO's goal is to prevent traditional medicine from becoming just a luxury commodity. It must remain affordable and accessible primary care for the communities that need it most. What does this look like in practice? Imagine a hospital where a cancer patient receives chemotherapy, but also acupuncture to manage the nausea and yoga therapy to handle the mental stress, all prescribed by the same medical team. Countries like China and India have done this for years. The Delhi Declaration encourages other nations to follow suit, creating a pluralistic health system where patients have the best of both worlds. Technology is the accelerator here. The summit highlighted how mobile apps and telemedicine can bring certified traditional practitioners to remote areas. With a new global library and AI tools, a doctor in rural Africa or a clinic in downtown New York can access the same verified data on herbal interactions. This democratization of knowledge is key to preventing misuse and empowering patients. The path ahead isn't easy. Regulatory hurdles, skepticism from the conventional medical establishment, and the massive task of standardizing practices across different cultures remain significant challenges. But the momentum from New Delhi is undeniable. The Global Center for Traditional Medicine in Jamnagar is now fully operational, serving as the command center for this global mission. The 2025 WHO Global Summit has charted a bold future. It's a future where we stop choosing between the past and the present. It's a future where science validates wisdom and where healthcare is more holistic, accessible, and compassionate. As we move toward 2034, the definition of medicine is expanding. It's no longer just about curing disease. It's about cultivating health. Thank you for watching.